Thank you, Tom, and good afternoon. I am pleased to report today that 6,893 Albertans have now recovered from COVID-19. We conducted nearly 7,000 tests yesterday and identified 48 additional cases of COVID-19 in the province. Currently, 38 people are hospitalized with COVID-19, with 7 of these in ICUs. In the last 24 hours, we have confirmed no new COVID-19 related deaths in the province. As we approach the start of summer, I want to take a moment to recognize the 151 lives that have been lost to COVID-19 in the province. These individuals ranged in age from 27 to 105, and while the majority had 2 or more underlying conditions, a small number had none. Independent of their age or health status, they will all be missed. My heart goes out to all those who have lost loved ones during this time, whether to COVID-19 or any other cause. It is these most tragic cases that we continue to work collectively to prevent. It has been nearly a week since we moved into Stage 2 of Alberta's relaunch. I have heard from many Albertans about their experiences in the early days of Stage 2. There is a variety of reactions to our new relaxed measures. Today, I want to talk specifically about living with uncertainty, which sometimes includes dealing with anxiety. I know that many people are resuming, at least in part, their pre-COVID-19 routines. Many people will soon be returning to work or resuming other elements of their daily lives that they had put on hold. For some, this is an exciting step. For others, anticipating this change may be causing moderate or even severe anxiety. Anxiety and fear can be triggered by change and uncertainty, and we have had a great deal of both in the last few months. Learning to live with uncertainty is one of the hardest things that any of us can do, and we have been challenged in this time of COVID to hone this skill. Our knowledge of COVID continues to evolve, as does our approach to prevention, as we seek to balance all the needs we have for human connection, meaningful employment, and protection from infectious disease. There is no one perfect way to respond to this challenge, and every path we could choose will have risks of some kind. It is not surprising that findings released today by the Centre for Addiction and Mental Health indicate the pandemic has had a significant impact on the mental health of Canadians. This national survey found that 1 in 5 Canadians reported feeling moderate to severe anxiety in the last few weeks, due to factors such as job loss or fear of the virus. While this was a decline from the peak of the pandemic, many of us are still feeling anxious about the days ahead. This is completely natural, and if you are feeling this way, you are definitely not alone. There are several things that we can all do to help manage anxiety in the days ahead. First, we need to take care of our physical, mental, and emotional health. Sleeping well, connecting safely with loved ones, exercising and meditating are all practices that can reduce anxiety. Secondly, remember that anxiety and fear are normal feelings. They are a part of our built-in mechanisms to keep us safe, and a small dose of worry can be a reminder of why following public health measures is so important. The challenge is to maintain checks and balances on the level of worry by anchoring to facts and knowing that collectively we have the ability to create safe and thriving communities. Following public health guidelines can help increase a feeling of being in control and can make a real difference. Lastly, I want to reiterate that supports are available. One free, simple way to get support is the Alberta Health Services tool, Text for Hope. These messages offer advice, encouragement, and ways of building resilience. Simply text COVID-19 HOPE to 393939. If you are feeling overwhelmed, you can also call the Mental Health Helpline 24/7 for confidential support or access counseling in your community through AHS. More information is available on all these supports on both the Alberta Health and Alberta Health Services web pages. We are in a new phase of COVID-19 in Alberta. While we continue to test widely and identify some new cases daily, the spread of the virus remains relatively stable. In fact, it is likely that Albertans will soon no longer need such regular updates from me. This is because the onus is increasingly on all Albertans to protect each other. That is why I want to encourage all of us, myself included, to continue to take responsibility for our actions and support others while they do the same. We all need to understand the guidelines and the importance of following them. I know there's a lot to learn, and it's natural that people may not know all the details of every guideline available. It is a lot of information. That's why I encourage all of us to show leadership and help each other. If your friends are hosting a backyard party, help make sure households practice distancing and know to bring their own refreshments. Or if you run a business, remind your customers of the measures you are taking to protect them and how they can protect your staff. Promote the fact that everyone should get tested, even with no symptoms. It's very easy to book an appointment online. And to be able to notify contacts quickly if anyone does test positive, please download the AB Trace Together app. These are all important ways of staying safe today, tomorrow, and in the weeks to come. I want to end on a happy note. Over the past few weeks, we've heard some wonderful stories through the Alberta Cares hashtag. The Calgary Food Bank thanked Linda, who dropped off masks her mom made for volunteers. Also in Calgary, musician Marvin Matthews released a beautiful, reassuring song called This Too Shall Pass, with messages of hope from the students of Blessed Marie Rose School. I encourage everyone to take a listen. It will make your day. And in Medicine Hat, real estate agent Jennifer Ellard received a Northern Lights Award for volunteering 5 days a week at her local food bank during the pandemic. If you know of a story like this in your community, please share it using the hashtag Alberta Cares, because Albertans do care, and messages of hope and unity can help all of us. We are all in this together. Let's continue to move forward with caution, to support one another physically and emotionally, and to keep each other safe. Thank you, and I'll be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller?
First is Michael King with Global News. Go ahead, Michael.
Hi, Dr. Hinshaw. With the number of active cases up about 30% in the past week, what needs to happen in Alberta to drive that number back down, and what can we expect in terms of active cases throughout the summer?
So we have seen an increase, as you say, in active cases with more people out and about and being engaging in different activities. I think what we need to see is, again, Albertans reminding each other that we need to collectively take responsibility for protecting our communities. And so the same basic messages that I've talked about for months now in terms of staying 2 meters or more away from each other, wearing masks when that's not possible, ideally wearing masks when out in public where you don't know if you may or may not end up being within 2 meters of someone, making sure essentially that if anyone is feeling sick that they stay home, and of course regular hand washing, not touching our faces, those really basic things. If all of us do that, then we are going to be able to keep the active cases low. And again, that's for individuals as well as organizations to support those measures within their businesses, within their places of activity, whatever services that are provided. We all need to pitch in and do this together.
Operator, can you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. There are now 3 more continuing care facilities in Edmonton with outbreaks. How many of the cases are in patients and how many are in staff? And this is the first time in many months since new outbreaks have been declared in continuing care facilities in Edmonton. What does this say to you and how concerning is it?
So anytime we have an outbreak in continuing care, it is of course concerning, as people who live in continuing care are at higher risk for severe outcomes from the disease, and they're also at higher risk potentially because of living in a congregate setting. So just to clarify, so I have 3 outbreaks. 1 is in a group home actually, and 2 are in continuing care in Edmonton. I don't currently have the breakdown of how many cases are in staff or residents, but we can get that for you afterwards. And again, what I would say is that this highlights the importance of all of us not being lulled into a false sense of security when we see low numbers in our community and thinking that we can start to move away from the regular public health measures, that we do need to make sure that we are supporting each other to stay home when sick, to get tested, and to make sure that all of the contact tracing and the work that public health does is supported, because those are the measures that are going to help to keep our cases contained.
Operator, can you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Should Albertans feel free to plan vacations outside the province but within the country this summer? And do you draw a distinction between driving and flying to a vacation destination?
So at the moment, we do continue to recommend that Albertans' travel plans stay within the province. And whether or not that changes over the summer is difficult to say. I know that Albertans want to make plans. I talked about just now the challenge of living with uncertainty, where we all want to make the most of the short summer that we have. And so I recognize that people are wanting to be able to determine, can they fly somewhere, can they drive somewhere. Again, it would be important for Albertans to look at the province if they are considering going somewhere for an essential trip. There are some provinces that do require a 14-day quarantine if an individual is going into that province from another province, and there are also provinces that are not allowing non-residents to enter. So it would be important for Albertans to check out those details before they plan a trip. And again, because right now our recommendation is, broadly speaking, that Albertans plan their travel within the province, I'm not currently making any distinction between traveling by airplane or by car. Again, essential travel is certainly something that can happen, and there are no current requirements, except for, again, as some provinces and territories do have some of those border measures in place. So it really is something that Albertans need to make sure that they're planning ahead, they're watching what those other provinces and territories have for requirements, and then making plans accordingly. But for the most part, I would encourage Albertans to stay within the province this summer.
Operator, can you put through the next question, please?
Next is Leanne Allison with Air 1061. Go ahead, Leanne.
Hi, Dr. Hinshaw. Thanks for taking my question. The City of Airdrie continues to strongly discourage residents from having garage sales, though some are opting to have them anyway. So what is your advice when it comes to garage sales this summer?
So I think that people need to be very cautious when they're thinking about an activity like a garage sale, where you could have many people who are coming together. Again, you have a lot of different surfaces that if somebody has their belongings out on tables, they're wanting to sell them. It's unclear if they would have had the opportunity to disinfect all of those belongings before they put them out. I think there's definitely risk inherent both in the that selling of one's own belongings, and as well as having multiple people, again, who possibly wouldn't otherwise interact in close proximity with each other. So if someone is planning a garage sale, again, I would advise caution, making sure that they're considering how to keep people 2 meters distanced or wearing masks, that can be potentially a location where transmission could happen. And so, again, while I would support the organizations that are encouraging people to hold back on garage sales this summer, if someone does proceed, they just need to make sure they're following all the public health guidelines.
Operator, could you put through the next question, please?
Next is Sarah Ryan with Global News. Go ahead, Sarah.
Hi, Dr. Hinshaw. This morning we learned about COVID tests that were potentially spoiled because they were leaking, but we didn't learn about it from you or AHS. It came from one of the people who had to be retested. So I'm wondering why this information wasn't shared right away when you guys found out about the problem from the official voices that Albertans have come to trust, and also how you feel about these faulty tubes.
So I did learn about this earlier this week, and what I understand happened was that some of the test tubes that had been used in sample collection did show up at the lab where they would be moved into their testing process, and there'd been a bit of leakage. There was no risk to anyone, so the samples were packaged appropriately, so there was no risk of transmission that happened through the leaking. And what happened was there are always a very small number through the routine lab process, a small number of samples, not just for COVID, but for anything that may need to be redone for various reasons. Sometimes a label is misplaced, or in this case, there's a bit of a leak. And so the lab looked at the particular type of test tube that was being used in these particular samples. And there were 4 different types that were seen to cause more leaks than they typically would see. So they did recall those. And anyone who had a test that had been taken that had involved that leaking, which was a very, very small percentage of the tests that had been taken, that they were contacted and offered the chance to have another test done. So it's something that's been evolving over the past few days, and we can get more information available on the exact numbers if that's something that's of interest. But again, there were no people were put at risk from the perspective of the leaking. The problem has been solved by recalling those test tubes that seem to have a higher proportion of leaks. And the individuals, unfortunately, I recognize it's an inconvenience for someone who has been swabbed to have to go back again. But they have all been contacted to make them aware that this issue was identified and that a recollection would be necessary to be able to run that sample.
Operator, can you put through our next question, please?
Next question is Emily Mertz with Global News. Go ahead, Emily.
Thanks for taking my question. We've heard from staff at an Edmonton casino that it has been quite full. Physical distancing isn't being adhered to. Machines aren't being wiped down in between uses, and staff nor guests are being given masks. Staff say they're being so rushed they're not even able to sanitize their hands between interactions. We've also heard of restaurants where servers aren't wearing masks. So I'm just asking if your recommendations are guidelines for these businesses or if they're requirements for them to be open.
So the guidelines set out what is necessary to create safe environments, and operators are required by the order that moved us into stage 2 to have measures in place that protect staff and patrons from infection. They're also required to make sure that there's high levels of sanitation, and they're required to ensure that they have plans if there is someone in that place who develops symptoms, that they're able to be isolated and then moved to a location where they can be appropriately isolated. And they are required to follow the guidance to the best of their ability. So what I would say with respect to these locations where there are reports of the guidance not being followed is that those organizations are incurring upon themselves a liability, that they're incurring upon themselves the chance for a large outbreak to happen. And I would encourage them to really consider carefully whether or not they would wish to take that on themselves, and especially where there are large groups gathered and masking is not happening and distancing is not happening, that really does put us all at risk, puts the community at risk. And so again, it's something that they would be required to go back and look at the order to determine if they are meeting those 4 requirements that they are legally required to meet.
Operator, can you put through the next question, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. I think we might have heard some reasons from the other questions here, but we've had about 150 cases approximately since the beginning of June in Edmonton alone. There's not been that quite of an increase in other places. Is there anything that is missing in Edmonton that isn't in other places? Or I know that you've spoken to this before, but what exactly is happening in Edmonton that isn't happening elsewhere?
So what we've seen in Edmonton is that there have been several gatherings that we saw that there has been spread outwards from a group of people that gathered, and then there's been secondary and tertiary transmission. So that secondary and tertiary meaning that people who were in that gathering who were ill then unfortunately passed to others, who then passed to others in some cases. So we are working very closely to contain that spread with a variety of groups. I want to again emphasize that it is so critical that if someone is symptomatic, if they are feeling ill, that they stay home, that they stay away from others and get tested. Because while we want to make sure that we are limiting spread, we also want to make sure that we know where COVID has spread to. And so it's important that we not shame those who have tested positive. I think that many people in Edmonton, but also in other places around the province, are seeing the low numbers that we had up till a couple of weeks ago, combined with our stage 1 and 2 reopenings, possibly as reassurance that the public health measures are no longer required. And so I think in Edmonton, we just happen to have seen over the last few weeks, again, a couple of examples where perhaps one person who was infectious spread to others, and that's continued on. We are, again, making sure that we're putting measures in place to stop that spread, but I think it could certainly happen in other places around the province as well if people are not following public health guidance. And if you have even one person who's infectious who attends a large gathering, it can immediately spread to many other people. So while we are seeing again this increase over the last few weeks in Edmonton, it's not to say that other places are immune, and it's just a reminder that all of us need to continue to practice all of those public health measures that are going to get us through this next several months to be able to continue having open businesses and more interactions, but to do so in a safe way.
All right, I see there's only one more in the queue. So operator, could you put through our final question, please?
Yes, final question is Brenna Rose with CTV News. Go ahead, Brenna.
Hi, just have a quick question or follow-up question to the travel question earlier. Dr. Hinshaw, you mentioned that you're recommending that Albertans stay within the province this summer. You know, we've seen some airlines this past week announcing that they're increasing more flights. So how much of a concern is it that people are not going to follow that advice, that they're going to go somewhere else in the country, get sick, and potentially bring new cases of COVID-19 back into our province?
I think it's important to note that there are a variety of different situations across the country. So some provinces have lower active cases right now than Alberta, and others have higher. And while I know that Albertans are perhaps starting to consider traveling, and again, while it is my recommendation, there's no legal requirement right now with respect to traveling interprovincially. So if Albertans are choosing to travel, it's important that they consider where they're going to and follow the same public health guidance wherever they go and when they get back as well. So if they are traveling to a province where the rates are very high, to be extra cautious in the activities that they undertake, and to make sure if they are in close contact with someone who is a case of COVID, that they isolate no matter where they are in the country, get tested, and make sure that they are not passing that on to other people. So again, while it is my recommendation to stay closer to home, at least for the time being, that may change going forward, it's also important to remember that wherever you go, you need to follow the same public health guidance.
All right, that's it for today. Thank you all for joining us, and have a safe afternoon.